love to take questions or comments from you about any of what I just went over.
Okay.
Yeah.
So, several years ago, I went to the FSH conference,
Mm-hmm.
and somebody said they're a carrier,
Mm-hmm.
and there's a lot of, controversy over that. So how would you say to answer that question now, if somebody was to ask you? So, can you be a carrier? Because from what you're showing there, you technically can be.
Yeah, so the term, so the question is about is there such a thing as being a carrier for FSH? So in genetics, usually the term carrier is reserved for recessive conditions where you have one copy of the genetic mutation but one normal copy of the gene. So you yourself don't have the disease, but you could have a child with the disease. So that's traditionally how the term carrier is used. But you could also think of it meaning a person has the genetic marker but doesn't show symptoms. So it might be more accurate to call them a non-manifesting, so the term that Dr. Leon used, non-manifesting, or you could say they're asymptomatic, or it could be that they're pre-symptomatic, that they just haven't shown symptoms yet, or that they're very, very mild. So
But they do have, but the bottom line is they still have the genetics.
Yeah, they would have the deletion, yeah, so they carry the deletion but don't show symptoms. So they could say, there's not really a good word for that, but you could say a non-manifesting carrier.
Okay.
Yeah.
But this was somebody that said, no, they don't have it, they just carry it.
Yeah.
So that's where,
Yeah, they're just not showing symptoms of
they're
it.
not showing
Yeah.
symptoms.
Don't
You
have
talked
it
about
as a relative term here.
Yeah.
Right, because it could be that if you looked hard enough, if you did a whole body MRI, you might find a little bit of changes in the muscle. But clinically, but for in terms of their self-perception and their life, they don't feel like they have FSH, it doesn't impact them. So, but you're right, but it is all relative.
Okay.
Yeah.
You talked about this mosaic
Uh-huh.
idea also, where you can have somebody who, like, in their muscles, they don't have it in the gene, but they can have it in their sperm and eggs. So
Mhm.
is that, so we have 3 children, we did PGD and we tested them, so they don't have FSH.
Yeah.
We
But
do PGN too.
is it possible that they could carry it through their, reproduction to their children?
In that situation, no. So the question is about mosaicism. So just to repeat for the people in the webcast, the question is about mosaicism. So a person who themselves has somatic or germline mosaicism could pass it on to their child, but then that child would have the deletion in every cell in their body, so they would be non-mosaic. So but it couldn't be the other way around. It's not like a person who has non-mosaic FSH could have a child who's mosaic, because the cells wouldn't revert back. They wouldn't lose the deletion. So if your children have been tested either by PGD or prenatal testing and they're negative, that means they're negative. And the chance that they could have a child with FSH is the same as anybody else in the general population. So very low.
Right, you cannot pass on a genetic change that you yourself don't have.
Right.
So,
Yeah.
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 So again, one from myself and one from online. The one online is, well actually, there's 2 online now.
Yes.
They're rolling.
Bring it on.
So, is it normal for an entire family affected and unaffected to be tested for FSHD?
Is it,
Do family units often get tested in their entirety? Is essentially the question from online.
some families do. It depends. So there are some families where if once one person has genetic testing and they're positive for FSH, and there's other relatives who have symptoms of FSH, they don't feel the need to get tested. They say, well, we know that it's FSH in my family, and I have symptoms of it. The doctor says I have it. That's fine. But there are other times when people do want to have it confirmed in themselves, either because maybe they want to have reproductive testing themselves, or if there's a person who's kind of questionably symptomatic or asymptomatic, they want to know for sure if they carry it. That would be a reason why multiple members get tested. Or if they're participating in research where it requires people to get tested. Yeah. Oh, yeah.
Okay.
Yeah.
Well, we want to go around. There's
Go.
still one more online and then one.
Okay, yeah.
Why don't we take
I just want to ask, I was diagnosed in late '86, and then with the nerve and muscle biopsy. and then went through like a second series of testing in the early 90s. And I remember that my mother had a biopsy done. My father did not, but he had some blood work done. My sisters were examined, and there was no physical symptoms and I'm just curious as to, they're 79 now, and although my mom has natural kind of health issues for someone at that age, I've always wondered the accuracy of the testing methodology way back then, and if in fact my example was really a mutation as they said it was, and they several had said it was, and I'm just curious.
So the question is, your parents were tested for FSH by biopsy, or maybe, and your sisters by biopsy or by clinical exam, but they never had genetic testing. So how sure can we be that they don't have the deletion? We can't be 100% sure until a person has had the genetic testing. Would you agree with that, Dr. Young?
Right. Yeah. I think.
And feel free to disagree.
Yeah.
I'm biased as a genetics person.
Right. Well, I'm sorry. Can you?
So the question is, if a person had a normal biopsy or a normal clinical exam,
Right.
how confident can we be that they don't have the deletion?
Not as confident as we used to be, I think.
Yeah.
I think as we do more genetic testing on more people, what we're really starting to identify are the people that are very, very mildly affected, and that section of the population it has to be larger than we ever thought it was. And so I don't think that, and so I think the genetic test is actually the best way to absolutely exclude it. At the same time, if you have no symptoms of it, then
The reason I ask is that in the case of my parents, it's one thing, but in the case of my sisters, who are 48 and 50, one of them has 2 daughters, and since they weren't properly tested, but they've never shown any physical symptoms, they're both very active. One's a yoga instructor, and they're both very, very active. They could theoretically be carriers and have it, but I curiously worry about my nieces potentially manifesting at some point, although we haven't seen it.
Yeah.
So it would seem to me to make sense for them to maybe get a more current testing methodology to be absolutely sure.
Good.
That actually ties in really nicely with the online question, which
Yeah.
is, what are the ethics involved in testing for FSHD for someone who might actually be a non-manifesting carrier? Which
Yeah.
I think is sort of getting at that.
Yeah, so
general way.
Yeah.
So to address first your question about your nieces, or just in general, apparently unaffected family members, what I would say, how I would counsel is that if they're concerned, then they can have testing. For children, if they're children and they're not showing any symptoms, I think it's most appropriate to wait until they're adults, and then they can decide for themselves. But it's if they need to be sure, if your sisters are concerned about this, your sisters could have testing, just to kind of put the question to rest. But you're right, that most likely they're all negative, but it's just to be 100% sure of the ways for genetic testing. But that does segue, as you said, into the online question about what are the ethics in testing a person who does not show any symptoms. And it's different if it's a child versus if it's an adult or near adult, someone who can make a decision for themselves. So genetic testing, it's just a blood test, but it's not just a blood test, because you're not just checking your blood count or your iron level. When you do a genetic test, the results could have significant implications for yourself, for your future children, for your other relatives. So we take that decision very seriously, and you should think about how might it affect you both ways. If it's results positive, how am I going to feel about it? How might it affect the different aspects of my life? How might it affect insurance, jobs, all of that stuff? And then if you're negative, again, how are you going to feel about that? So if it's an adult who themselves is concerned about maybe a non-manifesting carrier, I would say have genetic counseling, meet with someone like me, and then they can consider all of those things, and if they decide to get tested, go for it. If it's a child and the child is not symptomatic, we strongly discourage genetic testing in children, in asymptomatic children, because if the results aren't going to change their management. So let's say we had there's a 10-year-old child, the parents are concerned about him or her, but there's no symptoms, they're just concerned because they know there's a 50% risk. If we were to test the child and the child were positive, we wouldn't do anything different for them. You know, we wouldn't recommend any medicine or any therapies or whatever, so why would we put that burden of knowledge on the child when he or she can't decide for himself? So we encourage that the families to wait until their children are older and they can have the discussion with them, and then their children can decide for themselves. Yeah. Yeah.
Okay, well, the other, I do want to get to mine eventually, but the online.
We have plenty of time. Yeah.
The online question that sort of follows on this a little bit is, can anyone order the genetic test just through your primary care physician, or do you have to come through a specialist like here at KKI?
Theoretically, any physician could order it. It can't be done at any lab. There's only 2 labs in the country that do genetic testing for FSH. So we would encourage that the testing be done through a specialist, partly for the benefit of genetic counseling, not to, plug myself here, but again, it's important that individuals considering testing have the option to meet with someone to really discuss all the implications, because it's more than just a blood test. Yes.
Related to what you've been talking about, the online form, someone gave an example where someone got the genetic test, learned the results, and then didn't share it with anyone else in their family. And then subsequently, someone else in the family learned about that and was very upset. And so I think the question online is, without being explicitly stated, is, if you do that, do you have a responsibility to convey that to the rest of your family?
So if an individual has a genetic test, and do they have a responsibility to talk to their family members, it's up to them. I mean, the clinicians would encourage that because the information is relevant to the family members, but we're not going to pick up the phone and call your brother and say, hey, by the way, Tom tested positive, so you should get checked out. That would be unethical on our part. But families aren't, it's not always the Partridge family, right? And it's not, you don't always see each other, and it sometimes can be hard to pick up the phone and say, hey, Bob, I just found out this news. So it's not always easy to do, and it can be a difficult conversation to start. But we would encourage to share that information with other family members, because maybe they're having symptoms too, and think about how many years it may have taken you to get diagnosed, and years of pain or years of wondering, why can't I do this? Why can't I salute an ROTC? And you could shorten that odyssey for another relative. And for if you have younger relatives who are thinking about having children, again, this is something that they might want to know about before they have children. It might not change their plans, but it could. And so, more information is better that way.